We're following a developing policy story that could have significant consequences for the U.S. healthcare system. A new analysis warns that the federal government's decision to pause immigrant visas for individuals from 75 countries could worsen existing healthcare workforce shortages across the United States. The policy, announced by the U.S. Department of State earlier this month, halts the issuance of immigrant visas for nationals from countries deemed at high risk of future public benefit use. While applicants can still submit paperwork and attend interviews, no immigrant visas will be issued during the pause, which took effect on January 21st. According to the analysis, foreign-born workers from 69 of the 75 affected countries make up nearly 8% of the U.S. healthcare workforce, or about 1.2 million workers. That includes physicians, nurses, and a large share of home health aides and nursing assistants, roles already facing chronic shortages. Researchers found that more than half of healthcare workers from these countries are employed in healthcare support occupations, while the rest work in practitioner and technical roles such as doctors and registered nurses. The report notes that the visa pause could significantly reduce the pipeline of new workers entering the U.S. healthcare system, especially as the nation's population ages and demand for care continues to grow. The policy is part of broader efforts by the Trump administration to tighten immigration and expand so-called public charge rules. Even though most lawfully present immigrants are barred from accessing federal benefits for at least 5 years. The analysis also warns that the impact could be compounded by other immigration restrictions and deportation efforts. Estimates suggest current policies could reduce legal immigration by 1/3 to 1/2 over 4 years. Health policy experts say that without alternative strategies to recruit and retain workers, the visa pause could place additional strain on hospitals, long-term care facilities, and home-based care nationwide. This issue is expected to remain a focus of debate as the administration weighs immigration enforcement against workforce needs in critical sectors like healthcare.